संख्या 15/2026 केंद्रीय उत्पाद शुल्क 273 और 11 अप्रैल 2026 जिसका आशय हाई स्पीड डीजल पर सड़क और अवसंरचना उपकर को बढ़ाकर 36 रुपये प्रति लीटर करने के लिए वित्त अधिनियम 2018 की 6ठी अनुसूची का संशोधन करना है का एतद्वारा अनुमोदित करती है।
प्रश्न है कि माननीय मंत्री द्वारा प्रस्तुत सांविधिक संकल्प को स्वीकृत किया जाए। जो सदस्य इसके पक्ष में हाँ कहें, जो सदस्य विरोध में ना कहें। मेरे विचार में निर्णय हाँ वालों के पक्ष में सांविधिक संकल्प स्वीकृत हुआ। क्या वेणुगोपाल जी?
ऐसे वेणुगोपाल जी, एक बात बता दूं आपको, आज कई सदस्य आपके भी कहते हैं कि वेणुगोपाल जी का नोटिस में नाम हमारा था, आपने वेणुगोपाल जी को कैसे बुला दिया, ये भी कहते हैं। वेणुगोपाल जी बोलते हैं
आज आपका मूड अच्छा है।
मैं तो कहता हूँ पूरे देश का मूड ही आज अच्छा होना चाहिए। मैं तो इस मत का हूँ।
सर
देखो
सर in an extraordinary situation, an extraordinary gazette notification came yesterday night 9:55. Let us raise sir, one point, sir. My point, sir.
ఆడపిల్ల పుట్టింది.
ఆడపిల్ల అంటే అక్కడి పిల్ల అని, కానీ ఆ ఆడ అనేది ఎక్కడ?
వాళ్ళ బ్యాటింగ్ లైనప్ సాలిడ్ ఉంది. రామా ప్లీజ్.
సరే కమింగ్.
అయ్యా మామయ్యలు పెళ్లి కూతుర్ని తీసుకురండి.
కానీ పిల్లకి మామేలే లేరు.
కానీ మేమున్నాగా. ఎక్కడైతే మన కథను మనమే రాయగలము, మన గుర్తింపు మనమే ఎంచుకోగలము, ఎక్కడైతే మన ప్రపంచాన్ని మనమే మలచుకోగలము, అదే ప్రతి ఆడపిల్ల యొక్క ఆడ తమ మార్గాన్ని తామే మలచుకునే తెలుగు లేఖనీయుల కోసం.
Hello Samantha, how are you feeling? Okay. Okay. It's good to see you out of ICU. So I think with her case, we probably just need to be aware that she's been in hospital for quite some time. She's been in ICU. We're probably dealing with more hospital-acquired type infection. I think her risk factors are significant, and we'll have to ensure that we send off adequate samples and specimens.
So when do you think you'll be able to see your family again?
I really don't know. I don't know.
The hospital that we work in would have about a third of the patients on antibiotics. These drugs are life-saving. Antibiotics are essentially the therapies that we use that can combat bacterial growth, and that's essentially why we need them to treat infections.
Morning.
Hi. Morning, Mrs. Abrams. How are you feeling? You bit better? That's great. So AMR is antimicrobial resistance. It's really antibiotics that are no longer effective to treat infections. AMR is globally on the rise, and it's a threat to our survival essentially.
So, healthcare facilities face two challenges. You have patients that arrive with multi-drug resistant organisms because they've been admitted to another hospital, or they've come in with resistant organisms that they've acquired from the community. When a patient is resistant to antibiotics, you cannot predict the outcome, and that's a scary place to be in.
And we'll get some tests off to see whether we need to change your antibiotic treatment, okay? Okay.
The two most important things that the general public should know about antibiotics is number one, that they make life as we know it possible, and number two, they cannot be taken for granted. I think if antibiotics fail, then our loved ones fail. Antibiotic stewardship basically comes down to using these medicines wisely, understanding that sometimes we have to use more, sometimes we need to use less, and sometimes we have to use them differently. It's a little bit of a misconception that the onus or the responsibility is just on the healthcare providers. The responsibility is on all of us. So if the doctor says 7 days, you take it for 3 because your infection goes away, you may seem okay, but you could still have some cells that survived because they adapted and now they carry a resistance gene and they can come back stronger, more powerful, and may not then respond to the antibiotic. So overuse is a clear driver, but underuse and misuse of them also drives AMR. If we have a strong stewardship program in place, what we're basically doing is we're creating a protective shield around the antibiotic because we're thinking very carefully when we use them, how we use them,